This is a follow-along full body mobility routine you can do from bed or just from a comfortable surface on the ground. We'll begin with some stretches for the neck area, so looking all the way up and then all the way down, going slowly, breathing steadily, really feeling the movement through each of your vertebrae. Feel free to hold any one position for as long as you would like. And now let's take it from side to side, trying to keep the shoulders relatively still, good posture, and rotating our head as far as we can to the right, and then to the left, back and forth. Now we'll do lateral flexion. So again, trying to keep the shoulders even, still, and tilting our right ear down to our right shoulder, and then our left ear down to our left shoulder. Great. Next, we'll go ahead and just take our spine through cow-cat, one of the best ways of slowly improving mobility through your spine. So really rounding out your back and pressing your hands into the surface you're on, and then creating a curve through your back where you push your trunk down into the ground, alternating back and forth between these two states. Very good. Now we'll lie on our back. Start with your arms out by your sides and then rotate so that you bring your trunk somewhat facing one side, and then allow your upside arm to go all the way back to the ground and then to come all the way around to meet your other hand. This is introducing some rotation throughout your spine, but mainly throughout your thoracic spine. And now we'll turn and have your body face the other way. So you're almost side lying, and then unfolding your arms. Letting one arm go all the way back, and then all the way back to the other hand. Very good. Next, we'll go ahead and lay face down, so in a prone position, arms out by your sides. We'll rotate one leg over to the other side and try to take that foot and touch the ground on the other side of your body. This is continuing with spinal rotation, but focusing more on the lower spine, the lumbar region, and the thoracolumbar junction. You'll also feel a pretty good stretch through the pectoralis muscle, the chest muscle, of the side that you're going to with your foot. So back and forth, really feeling that rotation. And we'll come on up now. And actually lay back on your side and have one arm, the downside arm, slightly behind your head. And I'm holding a ball here just so you can see what I do with rotation of the hand at a certain point, but you're almost reaching back as though you're scratching the middle of your back, and then extending your arm straight out again, back and forth, just to introduce some motion through your elbow and also through your shoulder joint. And once you're warmed up, whenever you take your hand to your upper back, you can rotate your hand back and forth, so through supination and pronation. This introduces some nice movement throughout your rotator cuff muscles. Doesn't look like much, but it actually does quite a lot. So again, the ball is there so you can see the rotation, but you don't have to hold a ball. Same thing on the other side. We're lying on our side with the arm above us and behind our head. And just do some curls here, bringing the hand to the upper back. Really feeling this through your shoulder, through your elbow. And when you feel the area is nice and warmed up, whenever you bring your hand to your upper back, you can rotate your hand fully in both directions, supination and pronation. And if you can't go all the way with any of these motions, just do what you can. Okay, very good. Now we'll go ahead and lay on our back and we'll do more elbow work. So simply bringing your hands toward you, so flexing at the elbow, then extending fully, and whenever your arm is extended, go ahead and take your arms through internal and external rotation. So it's like doing a curl in the air, and then when your arms are straight out up above you, you're rotating your arms in full, internally and externally. And now with your arms outstretched, take your wrists through circles. You can go clockwise, counterclockwise. Just focus on quality of movement and really feel this throughout your wrists. Very good. And now we'll go ahead and just do some long axis traction or stretching of each of our fingers. So you'll use the other hand to gently pull out on each finger for a second or two, and also the thumb. Long axis traction is one of the best stretches you can do for your interphalangeal joints. Very helpful to those who have any type of arthritis in the hands. And then we'll go ahead and stretch back all of the fingers at one time. So you're stretching out the metacarpophalangeal joints, and also taking the wrist through pure flexion by pressing down on the outside of the hand. The other side, the metacarpophalangeal joints, really stretching back all four fingers at the same time. And then taking your wrist through full flexion, so really stretching out the extensor tendons along the back of the wrist. And always maintain steady breathing through all of these stretches. Next, we'll lean off the edge of our mattress, or if you don't have a mattress, you're on the ground, that's fine, just do this on the ground. And we'll do half circles with our arms, kind of like making snow angels during winter, really feeling our arms go through this half arc above our heads and down to our sides. If your arms can hang off slightly the edge of a mattress or bed, it just helps to induce more extension through your thoracic spine as well as flexion through your shoulders. And if you feel that this is not challenging enough, you can always hold something in your hands, a small weight. Very good. Now we'll go ahead and get comfortable, and you don't have to be off the edge of a bed for this. And put your hands over your ears, and keep your hands covering your ears, and do what are called shoulder hinges. So bring your elbows to your midline in front of you so they meet. By keeping your hands covering your ears and bringing your elbows to your midline, you are inducing motion through your shoulder blades, your scapulae. This is one of the safest and easiest ways to work on scapular mobility, which is essential to shoulder and thoracic mobility. Very good. Now we'll go ahead and just put the foot of one leg on the other thigh, and then let both legs fall over to that side. And the same thing going the other way. So let both legs fall over, and you can use your hand to pull your upper thigh over a little bit. And we'll just go back and forth for a bit here. So getting a good stretch through the lower back as well as the pelvis and the IT band. As always, make sure you maintain steady breathing and take this at your own pace. Very good. Now, while you're holding this stretch, what you can do is you can make circles with the upside arm. This is similar to doing controlled articular rotations, except you get even a little more than you would if you're standing, just because your arm is able to go back into slight flexion as it's going around in a circle. And if you have any areas of stickiness, any restrictions, go ahead and just take your time as you work your way through those areas. Very good. Just a few on each side. Go back to the original side. Some more arm circles. If you feel any areas start to cramp up at all, of course you can release and just relax your body. And then back to the other side. So get a good stretch first through your lower back and your pelvis, and then the arm circles. Okay, excellent. Go ahead and come on up and lay back on your back. So supine position with your knees bent, and then go ahead and bring your foot up on your other knee again, and just actively really try to create external rotation in your hip by pushing your knee out towards your other foot. And just take this back and forth a few times, really trying to maximize external rotation of the hip. And now we're going to do the other side. Take it nice and slow and really feel this through the hip joint. Very good. And now we'll do internal rotation. So you'll want your knees spread a little further apart so you have room to bring the other knee down, the outside knee, to really create optimal internal rotation through the hip. Just go as far as you can comfortably go, and then work on the other side, aiming for about 5 repetitions here. Really trying to maximize internal rotation actively. Whenever you let your knee back up, you can also try to externally rotate it as well, but the main focus is internal rotation here. Very good. We'll go ahead and just wrap one leg behind us. So really feeling a stretch through our quads and our hip flexors. And then go ahead and do the other side. You can use your hand, as you see, to help facilitate movement into this position. We're not having very long hold times on our stretches, just because we want to feel a stretch, but we want to keep things moving and work more on mobility of the joints as we're stretching the tissues that surround our joints. So back and forth with this quad and hip flexor stretch. Just a few seconds of hold time with each repetition. If you can't lay all the way back in this way, you can stay side lying and just use your arm to hold your ankle back as far as you can comfortably hold it. Almost done here. Very good. We'll go ahead and do some active hamstring stretches now. So using your hand to hold onto your foot and then extending your legs straight or as far as you can go. And if you can't reach up that high, you can always use both hands and a towel and wrap that towel around your foot to give yourself more length. And if you can't fully straighten your leg, it's fine just to go as far as you can comfortably go. Aiming for anywhere between 5 to 10 repetitions. So really actively stretching your hamstrings and your calves as well. Very good, and we'll do the other side. Some people hold on to their big toe while they extend here. I prefer to hold on to the outside part of my foot. It just feels more natural. And again, you can always lay straight on your back and use a towel around your foot that you hold on to with both of your hands as you do this. And just a few more. Very good. I'll go ahead and get comfortable on your back with one ankle on top of the other knee. And just do some small ankle circles, taking your ankles through their full range of motion. Clockwise, counterclockwise. Focus on quality of movement here. About 10 circles. Very good. Now we'll go ahead and do some unilateral modified bridges. So just reaching back with one arm up above your head, taking your back through extension, keeping your feet strongly pressed into the ground. This is excellent for spinal extension and rotation. Very well done. Thanks so much for watching. If you haven't already, please subscribe to our YouTube channel for more suggestions on how to improve your mobility and health. And for our most recent self-care suggestions, please use the link here to subscribe to our newsletter. All of this helps us produce more useful content. Thank you and see you again soon.